It's kind of on a continuum with acne. So if you look at bumps and things, sometimes there's acne over here and rosacea over here, and there is sometimes a little overlap. So many patients are confused whether they have acne or rosacea, and a visit to a dermatologist can help determine that. Rosacea is a very common skin condition that typically affects nose and cheek. It can consist of redness and flushing as well as bumps and even a little swelling. It can affect your eyes, and the eyes will feel gritty, dry, and you can even get little bumps or redness around the eyelash margin. It's most common to appear in your 30s to 50s, but can persist much longer than that and can show up earlier. So it sometimes is a little different between men and women get more of the redness, flushing, small, fine bumps, sensitive skin, burning, whereas the men get more the skin enlargement, swelling, larger bumps, and even nose enlargement. What I tell my patients, the two primary triggers is sun and dryness. Even mild exposures to the sun can trigger a flare, so we recommend a good daily sunblock. And then in terms of dryness, particularly in the winter, cold, windy day, many rosacea patients will experience a flare. One thing that is sometimes advised is that you keep a food diary or even an activity diary so you can track when you have a flare. So I went outside on a cold, windy day and I had a bad flare, then we know to address that with a healing, reparative moisturizer. And unfortunately, you may notice that some of your favorite foods, the spicy Thai foods or Mexican foods, may cause a flare. We can handle those flares, but it might be something to avoid. Unfortunately, often a lot of vigorous activity, hot exercise classes, hot yoga is so popular right now, and the spin classes, that can really lead to severe flares. And some people, their rosacea is so difficult to control, it's just important to avoid those. So I think everyone's rosacea is a little unique, and we want to, first of all, get a good history about what you're dealing with and what you've tried and how it does, what you think your triggers might be, and then I want to look closely at what your skin looks like so I can pick the best program for you, and that would include both prescriptions as well as a topical non-prescription regimen at home. Also for rosacea, laser or light treatments can be very helpful. Primarily the V-beam pulse dye laser targets specifically the blood vessels that are dilated in rosacea. Usually a series of 3 to 4 treatments is needed to get you the best results. These laser and light treatments are not done on their own. They're done in conjunction with the treatment plan we've come up for you. So that might be some prescription medications, a skincare plan, and then, hey, you've got some redness and broken capillaries. Let's make a plan to try to target those with the laser or light treatments.